Uh, and I will jump for the third part, which is the last part, about how to cope with the stress. As a physician, the situation within the pandemic, it's really difficult to find a balance between how to do what I should do or what I would like to do. Sometimes it's even more. Most of the physicians, they do 10 times more what they have to do, more than their duty, just to help some people. And I remember one advice from my supervisor. She said, if you want to help people, don't go over your limits. So, and find balance. So how to find balance or how to cope with stress within the pandemic for physicians, I mean, and also other medical colleagues, like medical staff.
Yeah, this is a very, very challenging area, especially when there's so many demands on you. How much choice do you actually have? So the practical part, I don't know if there's any information that I can share that would be helpful. I think from a psychological aspect, one of the things that might help motivate us to protect some time and make some difficult decisions, to say, actually, I can't help you at the moment. The ability to say no can be, it's a very difficult thing to do, to say no to someone. So we need to have some sort of a basis. And I don't want anyone to misunderstand. I'm not saying that we shouldn't help people. It's just understanding the limit. Mm. Yeah. And sometimes doing this through a story can often help. So I want you to imagine that we're not in COVID. This is just hopefully normal, healthy, good times. So the mother, she is very dedicated to her child. She wants the child to go to school with the best uniform, so it's really nicely washed and ironed. She makes sure the child has the best breakfast and best lunch, fully healthy, all the balance of nutrition, gives full time in the child's homework. So everything is perfect for the child. So this mother is doing an excellent job. Now, she's working hard and it's going to take its toll, but she's managing and she's motivated. This is important to her. So it's good. Now the mother falls ill. She has some infection, for example. She's getting a fever. She's feeling weak. Should she still spend the 3 hours on the child's homework? Should she still spend 2 hours doing the laundry and the ironing? Should she still spend 2 hours doing the cooking for the child in the same way? Now, if she keeps doing that, what will happen to her recovery?
Delayed or like prognosis bad. Yeah.
Yeah. If her condition gets worse and worse and worse, she may end up hospitalized. Mm-hmm. Then who's going to look after the child?
Yeah.
Yeah. So what we would say is that self-compassion. And compassion is potentially a huge theme, from a faith-based perspective, that if we want to have compassion for others, we need to have some compassion for ourselves. We need to nurture it within ourselves to be an ethical, authentic role model for others. So being able to know the limit, to say, if I keep doing this, I'm going to burn out. If I keep trying to help other people without being able to sleep enough hours for myself, actually I can become dangerous in my practice. And I mean, it's different, what type of practice, your decision making, your clinical decision making, your surgical skills. If you haven't slept enough, if you're not, resting enough, if you're not eating enough, these things become a risk for that thing that you're trying to do. And also in terms of your kind of psychological burnout, the negative effect on how you're feeling, your own sense of hopelessness, if you don't give some priority to protecting that time that, nurtures you, that nourishes you spiritually, that nourishes you emotionally, that gives you a bit of balance in your own life, then you can only expect things to go in one direction. What if you say protected one hour for yourself every day, where you said in my 24 hours I'm going to have 6 hours of sleep, I'm going to give 12 hours in my clinic, that gives me 6 hours left. Of that, half of it is spent in traveling and doing my administration and eating. So, you know, really, I only have like 1 hour left a day. If I schedule that time, then maybe I can plan how I'm going to use it effectively, right? And maybe I can do it in getting that balance that we've told other people. We have to practice what we preach. And if we've told people that try and get a balance in doing things that give you a sense of achievement, a sense of connection with others, and a sense of some sort of pleasure for you, something that allows you to smile during the day, something that allows you to appreciate that other blessing that you have around you. And, you know, to say, for example, my blessing is that I was educated as a doctor to help other people, so I have to use that blessing all the time. Does that neglect any of your other blessings? Well, it may do. Maybe you're blessed to have a beautiful wife, a lovely daughter. If I'm not using that blessing and I'm using all of my blessing for the patients, am I not neglecting those blessings? And I'm not saying that, you know, it's an easy decision, because here you're saving lives, and here you're maybe keeping your family and therefore yourself happy. But without that balance, it's going to have an effect on your clinical work. And, you know, if you want to be providing that high level service for years, you need something to charge your battery. If your battery is flat, that's it. You're going to be on the treatment bed as well.
Yeah. Even like for maybe there's many techniques, and maybe you will just give as tips. For example, what I do, spiritual part, I give it some part which help me really to calm down or to rest my mind. Talking with family also, like to keep it at least twice a day for phone call with mom, like that. Also, sometimes I used meditations, which even for 2 minutes, but it helped me a lot. Just mindfulness for 2 minutes. Mindful for my atmosphere, like the voices around me, deep breaths, to feel my presence in the time. Maybe other techniques you may just bring to mind, like advice.
Well, I mean, I just anecdotally again, and just linked to the theory of our core human needs, that you know, just the ability to switch off into something else. So I love following Manchester United. Now, I know we haven't had a good season, but see, when I'm looking at the score for Manchester United, when I see the players, I'm just giving myself a total break from the other tensions and stresses. Another one that people don't often talk about is the physical intimacy. And in times of pressure, when we're exhausted, it feels like that we can't engage with those things. But being able to protect a bit of time for something that's a natural part of our need can actually be helpful for us on a physical and emotional level. So it's another blessing that if it's available to us, that we shouldn't neglect.
Mm-hmm. So I think it would be a nice idea within the ER high load to remember that Barcelona get 8 kicks from Bayern Munich. Well, in the end of this amazing session, I'm really thankful for you, Sarfraz, for all these amazing advices. Maybe the last message you can say for the Iraqi physicians that will take the last message, and of course, inshallah, we'll have another session, sessions together for them to support as much as we can. Yeah, please.
So I guess my closing message would be that you're doing an incredible job, and just to remember how good a job you're doing, to try and keep an ear out for all those people who say thank you for saving my life, not just keeping the ear open for people who are complaining and stressed. So just listen out for those blessings. So that's, I guess, one point. And I guess the other thing is that you are in the position that you're in for a reason. You know, there's a deeper wisdom that's linked to your purpose, and alhamdulillah, what an amazing opportunity it is for you to be able to live your purpose and make such a huge difference in people's lives. So thank you for the incredible work that you do, and that the glory and the light of what you do will shine in this world and the hereafter, inshallah.
So, and my last message, I want to say that you were like your grandfathers in their 1920s when they fight the British occupation. They faced the heavy guns with very old instrument, which was sticks. So they faced the pandemic, which even like the biggest countries in the world couldn't stand in front of it, with very basic of supplies, medical supplies, medications, or what they still stand on their legs there to give their help. I'm thankful for everyone, for you, Sarfraz, for all my colleagues. Maybe I have one question from my colleagues. I have a question. Some people trying so many methods to release their stresses, but people made them feel shame. So it came late, but please, with your kindness, the answer for this colleague.
Yeah, no, I think it's really difficult, especially when you're trying so hard for yourself, and it's other people, it's the environment and other people's judgment that can make you feel worse. And I think there's maybe a starting point about your relationship with your Lord. I mean, this is something that may work for some people, is what I'm doing, is it shameful in front of my Creator? So let there be a reference point. Maybe that's not going to be easy for everyone to do. And I guess if there is at least one person in your life that you feel is less judgmental, make the opportunity to connect with them. Have one positive fuel coming into your life. And like I say, what you focus on grows. So if you focus on the people that try to bring you down, that try to make you feel shame, of course you're going to feel more shame. I'm not saying it's easy to stop that, but if there's a question, there's an answer, and the answer is part of the answer is going to be try and focus on the people who don't make you feel shame.
I hope it's clear. So, Sarfraz, thanks a lot for your time, for your help, and thanks from the questioner. Inshallah, we'll see you again, and thanks for all my colleagues for their listening, for their time, and fi amanillah.
Thank you very much, and I look forward to future opportunities to learn from you as well, inshallah.
Inshallah.